Good morning, everyone. Today is Thursday, January 11th. Thank you so much for joining our weekly healthcare reform webinars. I appreciate everyone giving your time this morning. We do have some things to discuss with the executive order from back in October relative to association plans and a few other things from the carriers. But before getting started, I wanted to introduce myself to the new callers. And my name is Deb Wilkinson. I'm the Vice President of the Health Plan Options Department here at URL Insurance Group. If you are new to the format, you can ask questions in one of two ways. You can raise your hand icon in the control panel to the right of your screen, or you can type in your question in the question box, and I'll answer that at the end of the webinar. So let's get started, and please, keep your questions coming. I certainly will not pretend to know everything, but I am happy to find out answers and get back to you. So first things first, let's talk about these association plans. We all remember back in October, or maybe we don't, that the president signed an executive order. It's certainly not law yet. There is a 60-day comment period, but there were some new developments last week. And it seems that they're really pushing these association plans. I think any of us that have been in the industry long enough know that the association plans are not necessarily the answer to this craziness. But the way these association plans have been proposed could really meet some challenges and also, change the way we look at group health and groups. There would have to be possible changes to ERISA to allow sole props and small employers to band together to form a large employer group. And right now with association plans, the ones that are in existence, they're all treated as independent businesses of those associations. So if you have a 10-person group as a member of the association, the law as far as the ACA and what the 10-person group has to, do as far as offering coverage and reporting, et cetera, is all based on that 10-person group. With these association plans, they're, again, talking about changes to ERISA to make them all seem like one big group. So imagine the confusion when a sole prop in Montana is part of an association that is subject to the ACA employer mandate, or subject to the reporting, the 1095 reporting, subject to federal COBRA as opposed to mini COBRA. So you can see that these are all going to bring a lot of challenges, and they're talking about allowing businesses in the same industry but in different states to band together, or different industries within the same state to band together. So what happens from this point on, not sure, but it is something that you should be aware of. There is a 60-day comment period, and what they do mention too is, in addition, any change does not preempt state regulations. So that means that individual states could still take steps to try to make it more difficult for associations to form. So again, the fat lady has not sung yet on this, but it is something that's interesting. We're getting a lot of questions on it, and that's why I wanted to share the information. So January 24th at URL, we are having a lunch and learn on the advantages to reference-based pricing with Starmark. Starmark is one of our carrier partners. It is a level-funded, self-funded program. They have programs that are network-based, such as Aetna or Cigna network. But the new programs, the reference-based pricing models, are affiliated with no network. And this is relatively new to the East Coast. There are carriers that offer it on a larger scale, but Starmark will go down to a smaller group, a very small group, and the employees within the group do not have to worry about going to any specific provider. As the PPO networks get more narrow, they're not going to be faced with some of those issues with all this stuff going on with the hospital mergers, etc. What happens is they use any provider, and the provider agrees to accept a certain percentage above Medicare, for instance. And if the provider does not accept that, it is never passed on to the employee, and it is never passed on to the employer in their claims reserves. So it is something very innovative, certainly something with, again, with all of these mergers and acquisitions of carriers and hospital systems, you know, it'd certainly be nice to have the ability to go anywhere. So if you are in the group market and you have any interest in learning about these products, please plan on joining us on the 24th. The registration link is in my newsletter. So speaking of mergers and acquisitions, of course, anyone in Western PA has experienced the not so friendly divorce and, you know, fighting over the children with Western, Highmark, BlueCross, Blue Shield, and UPMC. The Governor Wolf, did just put out information just reiterating and memorializing this consent decree. I do have the information from Vince Phillips' reg review, as well as the statement from UPMC on the consent decree, but it is of interest. It doesn't change a lot of what had been in the consent decree, but it just, again, memorializes and just is very specific to the hospitals that will be in and won't be in. Again, nothing new, no need to panic, but if you are in the Western segment, definitely take a look at the newsletter. Speaking of newsletter, Capital Blue Cross, last week and the week before, we talked about them really pushing the submission, renewal, and termination deadlines. And we talked about the 10-day requirement to send in a written notification to terminate coverage. They have changed that. The written termination requests, they are accepted from small and mid-market groups up to 5 business days prior to the termination effective date. So previously it was 10 days, give you a little bit more leeway to make some of those renewal choices and secure other coverage if that's what your clients intend to do. So again, just be mindful of that. Don't push it, please. Just know that hopefully within 5 business days of any renewal, you, as the great agents that you are, would be telling your clients to make sure to send in a termination letter. So the Orion program, we talked a little bit about this last week, but I thought maybe just kind of applying some practical applications for the Orion program. Life markets, Medicare offerings, annuity solutions. I know that most everyone on this call is really well-versed and in the health market segments and possibly in the Medicare segment. But what may happen is if you're writing Medicare and you want to market final expense to all of your Medicare clients or customers, we have a program that can help you do that. And you just sit back and collect a commission share. So there are ways that you can expand your revenue and your product offerings without having to reinvent yourself, if you will. If you're not in the Medicare offerings segment and you're well-grounded in the group health or the individual markets, then maybe that's something that you want to consider if you run across Medicare folks or annuities. So again, keep it in mind that we are here to assist you and help to expand your revenue and your client base. So if you allow us to do that, we're happy to help you. And if you want to know more about our program, the new programs, give me a call. I'm happy to give you all the details. Speaking of that, again, I've had this in the last couple of weeks, but it should not go ever without saying that I truly, truly appreciate your partnership for those of you that do choose to do business with URL, and we certainly appreciate your business. We know that you can go to other folks to get your support for your group health markets or any of the business that you choose to write through URL. But we truly appreciate that you chose URL and you've partnered with us. And, again, it doesn't go without saying that we truly appreciate it. I know I personally very much appreciate it. So that's it. That brings us up to the open forum where you can ask your questions. As you are typing in your questions, just remember that the next webinar is next Thursday, January 18th already. which is crazy to me. So let's see, there are absolutely no questions. You're either tired from fourth quarter or there's nothing to ask. Either way, I always truly appreciate everyone joining in. And if you have any additional questions, you can certainly reach out to me. I'm happy to take your call and discuss all the options available with URL. So again, thank you so much. I wish you all a great and happy balance of the week and a beautiful and wonderful, relaxing weekend. Bye-bye.